So it's data cooperatives that are owned by the people. Why do we say that people need to be part or at the center? Because health data needs to be integrated. Your genome data is not worth anything. You have to combine it with your blood pressure data and with your physical activity data that you can record on smartphones now. And ultimately, it's neither Apple nor Google, but it's only the citizens themselves who have the right to aggregate these people and these data. And we need the active participation of these people in Europe to do it. Health data is hugely valuable because you need it for clinical trials. That's why Roche bought Flatiron Health for $1.9 billion in 2018, because they had 2 million cancer patient records only from hospitals that they've structured. Now, imagine not only your hospital record, but your mobile health data records, etc., aggregated in a structured way. This would be even more valuable, and Roche would pay much more to access this data in a data commons that is controlled by the people. Now, at the moment, Roche turns away. They go to the US pharma companies because they can access the data. In Europe, it's not possible because it's only possible through the citizens. And we really have to think how we can compete in this data-driven precision healthcare and precision medicine, because the train has left the station already. We've talked about Amazon, we've talked about Google. This is the age of surveillance capitalism on one side, right, where companies control our personal data. And on the other hand, it's the state in China who controls all the data. So where are we if we need data to work with and to use artificial intelligence? Is there a third way for Switzerland and for Europe? And I think there is, because personal data have 3 unique properties. This includes health data, of course. Data can be copied, and as a European citizen, you have a right to a copy of your medical record, and you have a right to a copy of your shopping record and of your Google and Facebook records. And so you can actually generate a parallel personal data ecosystem. We all love Google and Apple. We want to use their services, but we can generate a parallel system. As I already said, data are equally distributed amongst all the members of the European Union. We all are billionaires in genome data, and that's why a democratic control of data banks as data cooperatives that have this one member, one vote principle is suitable for inspiring trust. And then thirdly, most importantly, as I already said, only we can aggregate all the different data. So the largest knowledge and economic value also for the benefit of society is created when we put the citizens in control. So in 2015, we started the first experiment with a data cooperative. This is MIDATA. This is the website you can go to, and you see all the different projects that we're running. It's running. I'm going to tell you what is good and what is not working and what we have to improve. So the MIDATA governance of this data cooperative, it's a not-for-profit, citizen-owned data cooperative. The citizen is in full control of their personal data. There are no financial incentives for data sharing. So you share the data because you want to contribute to the common good. We use standard interfaces like HL7 Fire, and we have a cloud-based, secure and tested IT infrastructure that is hosted in Switzerland. So this is all good. We've run several projects. We have about 20,000 people who had accounts and deposited data there. So this is basically the data cooperative. It runs an IT platform like a bank. You have e-banking possibilities, but it's not owned by the shareholders of the bank, but by the General Assembly, by the members of the cooperative. It has an ethics committee, and it has its governance rules, which you can download from the website. Now, this offers data services from third parties that can access the data or that can collect data and have them stored and under the control of the citizens. So new data services that do not monetize the data, but they actually monetize the service that they give. Like in financial services, now you pay for getting an analysis of your personal income and what you should do with it when you retire. So this is what is good. So the lessons from our cooperative model is that it's positive, it's governance as a data cooperative, it's secure IT platform is good. Why haven't you heard it, and why isn't there a MIDATA cooperative in Germany and in Sweden and in Finland? So far, we have not been able to actually get people to engage. You know, the iPhone engaged everyone since 14 years. We wanted to get an iPhone, and no one wanted to get a MIDATA account because there was nothing direct input or something that they can get. And we don't have coherent data sets. We have some allergy data sets and some COVID data sets, but these data by themselves are not yet interesting. So there is no personal benefit. So the lessons learned from this for a future cooperative is that, yes, we need trust. I think the cooperative governance is a good one, but most important, we need to put forward personal utility and benefit for the participants. Like you download apps because you said, hey, I want to lose weight or I want to measure my blood glucose level. There must be a personal benefit, direct, immediate feedback. The cooperative also has to collect other data in a mandate from the citizens to make the data richer, also for the personal benefit and to make them economically viable. But that creates a lot of economic value for society that is presently unused. And there will be new data services. Think about all the financial services that we get when we retire, and we can ask how we should invest our pensions, etc. So Europe could become a forerunner in a digital health environment, in a digital future, if we go towards a citizen-centered platform. I see this as a sort of a data infrastructure in a city where you have different services. For mental health services, you have patient advocates, you have fitness training, you have other patients advocates. These are the needs that different people have. But if the data are stored in their accounts and they agree to serve them in a data commons, then this creates value for themselves and for society at large. So in summary, I think we really have to think differently and not power to the people, but data to the people in a data democracy. And this, I think, is the European way to sort of come up. But it needs to come from the citizens. There's no parliament that can decide that. The utility has to come from the citizens. There was no parliament that decided whether we should have smartphones. And today, there are more smartphones than toothbrushes in the world because they were so useful. And we have to create this utility in the first place. That's our learning from our first data cooperatives. Thank you very much for your attention. And back to you, Matteo.